Hello, 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 everybody. Um, I am glad to try and be back and do some type of recording. I've been gone for the past month. December the 5th, I had back surgery. And so they had to go in and remove my disc in my back. So on December the 6th, I caught a blood clot in my leg. So they had to go in and put in a stent in my leg. And I looked at the blood clot and it was wow. But so right now I've been into three facilities since I last did a recording. Um, the first facility was in Atlanta. Uh, I was basically supposed to just been getting my L4 and 5 fusion done in my lower back because it was giving me pain with walking. And so they done that, but when I woke up from the anesthesia, I was in excruciating pain in my leg. That is the most horrible feeling I have ever felt. Um, I woke up screaming because the pain was so excruciating that I could not endure it. And I was calling for my doctor and like get him on the phone, give me something for pain. Um, and he came by and he said him and two other doctors had been up all night trying to find out what was going on with me. That's when they found out I had a clot in my left leg. So they had to go in and remove the clot that was in my left leg, and they ended up putting in a stent. So now I have a card that I have to carry around. I guess if I go through the airport or anywhere like the airport, I will have to show my card. If I go in a federal building, I have to show my card because it's gonna beep uh, with the rod in my leg. And so I am glad I'm not out of the woods yet. I'm still having pain in my foot, my left foot, and in my lower back. But I'm still getting treatment and trying to find out exactly what is going on with my foot. So they have ran tests. I don't know if I got another clot in my leg, and that's the reason I don't have enough blood flowing down in my foot. But what I did uh, come across is that when I woke up from surgery of the second one, when they did the stent, that was on December the 6th, they were tapping on my foot. And I'm like, okay, what's going on with my foot? For a minute, I thought I was going to lose my foot because they kept tapping on it. And the nurse was in there all night, just tapping on my foot, trying to get an ultrasound. What that does is show if you are oh, hi, Stay Dangerous. How are you doing? Thank you for praying for me. You're welcome to come up if you like. You know you are. I miss you so much. Um, but what I did find out is that let me see if I can copy that. I'm not quite sure if uh, let me see. I'm trying to copy the whole thing to put in there, but I don't even know if I got it correct. No, that's not it. Let me see. I don't have that down yet. So it's something I'm doing wrong. I've been gone over a month, so I'm still trying to relearn what I've already learned. So that's going to take a minute for me to do. Um, but I'm going to go ahead on with what I am uh, discussing as far as my leg. My leg was in excruciating pain. When I finally came through after they put the stent in, I felt them tapping on my feet. I didn't know if I was going to lose my feet or what was going on. Um, I was supposed to have been in the hospital for 2 days, in and out. I ended up being in the hospital for 5 days. When I got out, that Thursday was the first time I got up and walked. Um, I was able to walk back and forth to the bathroom, and then they let me go. So I was able to drive home. I actually drove to Atlanta to get my surgery done. And so I'm in North Carolina. I was able to drive home. I didn't drive, my daughter drove, but I was able to go home. So what I did, because I was afraid after having both surgeries, I went into a rehabilitation um, center, and this is where they help you and make sure you're able to walk and take care of yourself. With laying in the bed for 4 days, I was sort of skeptical about going home. I didn't want to go home, and I didn't know if I could walk. I ended up being on a walker uh, this past week. Now I'm able to walk by myself, but for 3 weeks, I was on a walker. Um, So this facility is close to my house. It's actually down the street. I said, okay, I'm gonna go in there, make sure I'm able to take care of myself as far as putting your clothes on, um, being able to walk, being able to physically dress yourself. And that was one of the reasons I went in, because I didn't know if I was going to be able to do that. I didn't want to go home and then I accidentally fall. And then I caused more problems. So I went in there for a week, um, doing the exercises, having somebody there to make sure I'm able to get up without falling. And they had me on a walker, so I was able to get up, push myself up, and use the walker. And then I was able to walk. Once I was able to walk, I was able to walk in that facility. They released me and let me go home. So I actually stayed in there for 7 days, 1 week. When I got home, I went to see my primary care physician. And this is crazy, y'all. I clap for God, this is crazy. She called me after I got back home because she ran some tests on me. She said, she looked at my legs and she said, the leg with the stent in, you have an infection. So I end up back in the hospital here. I was in there for Christmas. Who wants to spend Christmas in the hospital? But what they said is that I had a skin infection from them putting the stent in. Um, not quite sure exactly what happened there, but they put me in the hospital and had me on the antibiotics, trying to clear up the infection that I had caught, I guess, from the stent. Uh, because that's why she noticed it. She was looking at my legs. That when I went to the emergency room, they called me about 5 o'clock in the morning. So anytime a doctor call you at 5 o'clock in the morning, you know it's a problem. They said we need for you to go to the hospital because you have an infection. And I'm like, okay, well, let me rush and try to do what I got to do so I can go over here to the emergency room. And before, I think I was maybe there for about an hour, my foot started hurting. That is the most excruciating pain I've ever had to do in my life. It's worse than having a baby. I felt like my foot was on fire, like somebody just literally put my foot in fire. I thought I was going to lose my foot. I thought my skin was just going to start falling off. I didn't know what was going on. They was trying to give me medication to calm me down, but that just wasn't helping. I haven't prayed so hard in my life, but I prayed, and I didn't know if I was going to make it, and I started calling my dad and my daughter and, my family members that are close. And I remember asking my dad to pray for me because I was literally frightened. I didn't know what was going on with my foot. Um, I was saying, get a fan, get some ice. I mean, when they say in the Bible that the Hebrew boys was in the fire, the burning fire, and God brought them through, I can remember me hollering for God to bring me through because I felt like my foot was on fire. Now, nobody could understand what I was saying. My foot felt like it was in some type of, gosh, like it was in a shell. And you can use a hammer and some tweezers or whatever they call it to crack it open. And it still has that feeling as if it's in a box or something. Um, the vascular surgeon understood what I was talking about, but the average person probably didn't understand what does she mean her foot is on fire. We sitting there looking at her feet and her feet ain't on fire. But in my mind, that's what I felt. The excruciating pain of my foot being on fire. So when I was kept saying, where are the vascular doctors? Because they had told me when I left Atlanta that I needed to see a vascular surgeon. Uh, they did come in. They sent a team of vascular surgeons in. And then they were tapping on my foot, trying to listen with ultrasound, just like they do a baby, to find out what was going on with my foot. My foot is still giving me problems. They let me come home 2 days after Christmas, so I was home for New Year's. They said that I had had too many major surgeries, so they could not do another surgery on my foot at that time. My foot is still giving me pain, excruciating pain. So today I'm talking about the new laws if you need medical care. Hi, Miss V. How you doing? I'm glad to see you. I am so happy to see you. I've been wanting to reach out, and I just couldn't at the time, trying to heal from surgery. But the new laws that are in place, uh, due to the opioid crisis, now if you leave the hospital, they don't like prescribing narcotics. Um, Basically, and I was asking them, are you going to send me home in pain with no medication? Because I was in excruciating pain. They don't like prescribing narcotics. That's the new law. So I end up going to my primary care physician, like, please give me something for this pain because I'm getting sharp pains in my foot. Uh, I mean, it's just popping my foot, wherein you're in tears. So they did give me some pain medicine, and I definitely appreciate that. But now the new law is that if you need additional pain medication, you're going to have to go to a pain clinic. And so Getting in the pain clinic in my area, it was, they said they are out to March. They did schedule me an appointment for February. So basically, what you're telling me is that I got to stay in this pain until February. I said, are you kidding me? So my primary care, they kept pushing them. She really needs to get in and get something for pain. So in order to get pain medicine now, they are requiring that you go to a pain clinic. A pain clinic can prescribe you medication because they can monitor it for the pain that you are enduring in your body. The primary care doctors can give you only so much at a time, like 3 days of pain medicine. And then you're going to suffer some time with this pain. I've endured the pain. I have cried. I have prayed. I have called whoever, just give me something for pain. And it's ridiculous. So today I'm wanted people to be aware of the new laws that are in place. So if your primary care say that they can't give you anything, or they can just give you something for short term, and the only reason now they are helping me now is because I do have an appointment with the pain clinic. And I'm like, they called me and said, well, we can get you in earlier, which is Monday. So I'm like, great, I can get in Monday to maybe get me a prescription to help me with this pain until the doctors decide what they're going to do while they're running this test to make sure exactly what's going on. I don't like the new laws. The new laws require that you may have to endure some pain when you get out the hospital, because the hospital does not like giving you pain medication. If you are in pain after having surgery, you are in excruciating pain. This type of pain is no joke. Trust me, it's no joke. It brings you to your knees, in tears, literally crying, because that's the type of pain it is. And they want to send you home with no medication because this is the new law. So if this happens to you, I say see if you can get in the pain clinic. If you're doing some type of major surgery, go ahead and see if you can get scheduled for a pain clinic in your area, because you're going to need that pain medication. And a lot of doctors does not like to prescribe it, the pain medication that you're going to need. And the only way to get it is to get in a pain clinic. And that's something you can get a referral from your primary care physician. So the reason it has become so crucial now is because people have taken the advantage of pain medication. They've taken the advantage of prescription drugs. The difference between prescription drugs and over-the-counter drugs is that prescription drugs you require a doctor to prescribe. Versus over-the-counter, and you can just go by and pick it up and pay for it. So that's the difference between prescription drug use when you need medical, which requires legal medical prescription drugs. That's what you get from the pharmacists. Some people have gotten addicted off of painkillers. This is another reason for the new law that's out. It's because people are getting addicted. Some people, not all, but some people have gotten addicted from the painkillers and running from doctor to doctor to get drugs. Most people that do get addicted are teenagers and young adults. That's when it end up being the opiate crisis. If you can go back and remember uh, when they had the war on drugs, abusing prescription drugs can cause a number of problems. Prescription drugs can be especially dangerous and even lead to death when taken a high dosage. When combined with other prescription drugs or certain over the counter medication, uh, when taken with alcohol or illegal or recreation drugs, it could lead to death if you're not careful because a lot of people are overdosing. And that has become the opiate crisis. And this is one of the reasons why doctors do not like to prescribe medication. So, even with taking prescription drugs, you have to be careful. Number one, that you don't get addicted to it. Number two, that you don't take too much and you follow the doctor's orders as how much you do need to take. And I say another thing is keep these drugs out of children's hand. If you are on prescription drugs, make sure they're aware your children cannot get them. And if you have finished them, or if you got pills left over that you no longer need because you're doing better, flush the pills down in the commode so that your children won't have access to it. Because uh, a lot of kids may be using it as recreation to get high, and that's what we don't need. And nowadays, you don't. People say, "Well, not my child, but uh, your child too." I had to learn that. Uh, According to the CDC, 23% of drug-related deaths are due to prescription drugs. Uh, 23%, and that's pretty high. And I guess, and this has been going on since for a very long time that they have tried to stop prescription drug use because a lot of people are misusing it and turning it into illicit drug. They're selling it, and then that leads to the opium crisis. So this is the reason I think for the new laws, and the reason they're not allowing you if you're in the hospital. They give you your other medications, but a lot of times they're not allowing you to come home with pain meds. And the only way now to really get pain meds is to go through a pain clinic. Um, and at first, I didn't know what a pain clinic was. And I had to learn that a pain clinic, because I'm like, well, I'm not on drugs. I don't do drugs. What are you talking about? And and I'm like, well, they're basically managing your pain level, but they will prescribe you pain medication. And if you're in excruciating pain, you definitely need it. Um, I say if your area is booked, that's the part I didn't like. Or am I basically supposed to sit in pain until I can get in the pain clinic when I got excruciating pain going on? And so my primary care, she was able to prescribe me medication, but I also had to have a date as when I can get in the pain clinic. So that really does help. Um, with her prescribing me, like, and then they moved my date up until Monday. So that helps a great deal. It's like give me some for a couple of days and then I can get some once I get in the pain clinic. Uh until I can find out exactly what's going on with my leg and back, uh the lower part of my back. Because they want to say that my foot is coming from the lower part of my back surgery. Uh I don't know how true that is. So they're doing tests all the way around. But it's just to bring you aware and making people aware that it could happen to you. Uh, Definitely, if you need pain medication, now you know what to do. Get with your primary care, let them refer you to a pain clinic. If you're going to have surgery and you're not quite sure if it's going to be excruciating pain when you get out, make sure you get something in line if you do need pain medication, but also make sure you're not abusing it, because I think that's the reason for the new laws. It's because it has been so much abuse of pain medication. And it makes it hard for people that are not abusing it. And that's where I feel like I fall in. So I'm sort of upset because you got this new law out, but you're making it harder for people that really need the medication and they can't get it because of somebody else that abused it in the past. So it's like you're being punished for something that you didn't even do. Um, and that's the way they kept letting me go through pain. And I have been through some excruciating pain, and I felt like the reason I was going through pain is because it's like you're out here begging for some medication to stop hurting because somebody done abused it in the past. And I'm like, okay, but I'm not that person. Uh, so it's like the good got to suffer with the bad. This, I hope that makes sense. I don't like the new laws, but this is what's going on now, and people definitely need to be aware of it. Um, that you could basically leave the hospital and be in excruciating pain, and they may not give you pain medication. Um, and your primary care can give you some, but I think I went 3 days waiting on my doctor to get back in, and I'm at home in excruciating pain, literally crying for help. Um, and once she got to work, then she was able to, bring me in and help me out. So I just want people to be aware of the new laws that are out. Uh, it's not easy getting pain medication, and even going to the drugstore. Um, they don't call your primary care physician if you need pain medication. That's something you have to do on your own. So things has really changed. It's like you can call my primary care when I need any type of medication that's on my list, but you can't call and say she need painkillers. Uh, they don't do that anymore. You have to call your doctor and get a prescription. So things has changed all the way around. And even with getting these prescriptions, I have to show ID uh, because they're narcotics. So you have to show ID. just bringing awareness. Um, and I guess the new laws are due to the opiate crisis of people abusing prescription drugs. And so now the good people have to suffer for what bad people have done in the past. I say be mindful if you do get pain meds, make sure they're not in reach for your children to get it. Um, because you definitely don't want your children using prescription drugs. And what I've done is when mine or I'm not using it anymore or something has changed, I'm normally pouring them in the Cobol and flushing them or making sure that you dispose of them in a way that your children does not have access to your prescription drugs, especially if they're painkillers. All right, so I'm going to end it there. I enjoyed being back. I miss everybody. I declare I do. I haven't been able to do a recording in over a month, so um, just bear with me and have a great day. And I love y'all.